Jason Rogers. I am a clinician-researcher. I share my time working as a musculoskeletal physiotherapist and as an early career postdoctoral researcher at the Menzies Institute for Medical Research as part of the University of Tasmania. I graduated as a physiotherapist in Melbourne at La Trobe University and then went on to do a master's in musculoskeletal physiotherapy at the University of Queensland. I travelled to the States and worked there as a physiotherapist for 6 years. I always had an interest in improving my understanding, in particular of foot conditions, and so I came back to Tasmania and undertook a PhD at the Menzies Institute for Medical Research, investigating chronic plantar heel pain. My program of research is concerned with understanding the different subgroups or phenotypes of persistent foot pain in the area of chronic plantar heel pain. My preliminary research identified that there are potentially modifiable subgroups that operate within the broader diagnosis of chronic plantar heel pain, and what we find is current treatments, there is no gold standard, and so my research is about understanding if we can improve how we target care to these different subgroups of heel pain. In particular, we found that up to 50% of people with chronic plantar heel pain have a type of bone stress or stress reaction in the heel bone, which we refer to as a bone marrow lesion. And these are common in other conditions such as osteoarthritis, and they're associated with having heel pain and with a poorer trajectory over 12 months. So my next project is to embark on the BALSA trial, a randomised controlled trial investigating the effectiveness of a bone targeting treatment known as radial extracorporeal shockwave therapy, and comparing that to sham shockwave or an active shockwave to determine if targeting these lesions in a BML positive subgroup of people with heel pain come to better outcomes in a timely manner. I've always had a long-standing interest in feet and research, and particularly as a clinician. Chronic plantar heel pain is a condition that we see commonly. It affects 1 in 10 adults in their lifetime, and it's the most common reason why individuals with musculoskeletal foot pain consult a healthcare professional. And what I found was that clinically, often the results were far less than what you'd like to see. And we know that up to a third of people with chronic plantar heel pain follow a protracted course with ongoing pain, dissatisfaction and disability, often many years later. So my research interest was particularly focused on better understanding how I can take knowledge to the clinic to improve treatment outcomes. Outside of my work and research environment, I love to experience the Tasmanian bush, whether that's going for a run or hiking or camping. My winters are occupied on a Saturday by supporting my son's Premier League hockey team, and ironically, when summer does come to Tasmania, I love to jet off to Japan to experience the powder cuisine and the culture of a fantastic country.